that the doctors give babies all those shots, and they want to give them to them sometimes, just over and over again. I got a cousin that his son, and he said that he think it's a result of all that he given, and he's like, uh, I guess autism, or he just real slow, like laid back. He's not progressing like the other kids.
Oh, he's developmentally delayed.
And he said he felt like it was all those shots that they gave him. He's like a little teenager. I think he's 14 now, 13, 14. But he got so many just issues, just not progressing like he should.
Okay, well let's look at this way.
You have to do a show on that. I mean a show. You really do.
So if you just look at it, if you look at it this way, if you have every type of drug is a toxin. That's part of the definition for it. A drug has to be toxic to the body in order for it to be considered a drug. It can be a little bit of toxin or a lot of bit of toxin, but it has to be toxic to the body in order for it to be considered a drug. So that means it was created somewhere in a lab. It's toxic to the body. So if you add all these different toxins to a little bitty body, and it does not know how to get rid of these toxins, then you have a buildup of toxins
in your body.
Exactly. And a lot of times those toxins build up in the brain.
Okay.
Because the brain is and when you're little, like it builds up in the fat, right? So you have the most fat on your body, but your brain is all fat too. Especially when you're that small. And some of them are able to cross the blood-brain barrier, then you have that. But do they really need those?
No.
So I know another doctor.
I think it's, but I don't mean to cut you off. I think it comes to when the adult has to be educated to know to say, because the doctor says it, you don't have to, you know, because he says it, you should, you know.
You have a right to refuse it.
Yeah. And a lot of people don't. They just go with that.
Also, and out in over there, and he has two boys, and he told me, because I used to go to him before I knew about you. He said he told the doctor he was not going to let his kids get that, and they did not give it to him. He said he had to fight them hard tooth and nail because they didn't want to let him in school. You know, when they got sold, but he said they're not going to put all this stuff in his kids' system.
Yeah,
you know better.
And I mean, he was, and they're healthy. They're good and healthy.
Most are. You know, it's okay for you don't want to get the chicken pox. Why not? I did.
Yeah, and you have to get it for your immune system.
It's all part of your immune system. The thing is, kids put things in their mouth to help build their immune system. That's like what they do. And so it goes through that natural pattern of being ill, right? So you put it in your mouth, mucus breaks it down, gets the rest of the body aware, or it goes through your nose. Everything, all the mucus in the nose gets the body aware. This is what's coming. When you break this, if it's on the skin, it lets the rest of the body know. But if you break through the skin and you skip all those steps of getting the troops prepared, then you got an ambush and they all sleep in the bunker. You know, then they can't do anything about it.
The army's not working.
You're right. So you have to get all that. You have to go through those steps, and it's okay. But you know why
they build up your system.
Yeah, but you know why they get all those shots every time they go to the doctor. What are you going there for? If you're going, if they don't do anything, it's hard for them to justify billing your insurance company to get paid for something.
That's true. The money was I see up here that 4.1 billion in revenue. Billion.
Yeah. And that's for these chemical imbalance drugs. And the thing that bothers me about a lot of this is you listen to some of them hip hop songs, they like talking about these drugs. Like I know I've heard Lexapro in somebody's song.
Really?
Yeah, they talk about a lot of this stuff. Like, oh yeah, that's the thing to do is to be on these drugs. Like it's crazy.
Brainwash.
Yeah. But but a lot of them probably don't need it. But a lot of the stuff, when you come to these chemical imbalances, you can actually improve yourself through movement. A lot of movement, like walking 30 minutes a day is equivalent to taking one of these drugs. Scientifically proven, huh?
Without side effects.
Yeah.
But
So
the
yeah,
doctor won't tell you
it's
that.
sending people all through this. Yeah, you would be depressed. And then here's some of the questions that don't get asked, right? Why do they occur together? The mental health conditions occur with the physical conditions. Because if you're not doing anything, for one, your body doesn't get that stimulation. It doesn't. Your cerebellum doesn't get woken up. It doesn't turn on your brain. Then, for one, for two, you start to gain weight, stuff like that. So you deal with that type of stuff. So that builds up toxins in your system. So you have that chain that you're going on. Early life stress, that's coming out that birthing process. And then the other thing is you get bombarded with toxins. So if you get bombarded with all these toxins, in addition to you've been dragged around by your head when you came out, we have those things. And then what if it is a symptom versus a disease? Which it very well could be a symptom of body can't eliminate toxins efficiently. Right? That could be an easy thing. Or the gut bacteria is not functioning properly. That could be another one. So it could be a whole body thing that we're dealing with. And it could be just a symptom, but we've classified it as a disease, which modern day medicine is symptom treatment, so it would make sense that they've classified it, as a disease when it's really a symptom showing up.
Because I heard, but this comes from a doctor, a holistic doctor. He said the average American baby born has 200 toxins in his body when he's born.
Could be. And part of that could be from, you have to think about the things that were in the water. Yeah, things in the environment, things that are in the clothing, things that the mom may have been exposed to in the food.
Or exposed to.
Yeah, when people go out to eat, you never know what you eat. You go out to eat. They have all this new fake meat.
Oh Lord, that scares me.
And you have this food like Beyond Meat
and all the other. If you look on labels, got all this other stuff in it.
Yeah, so you have all these chemical concoctions that
to make something
to make beans taste like beef. Like how many chemicals do you have to get the flavor of beef? So out of a bean. Yeah, so
that makes no sense.
No, instead of just whatever it is, tastes like whatever.
But that goes into the fake meat thing, right? So we're already eating fake meat. People are eating that type of stuff. So it's already fake meat. So who cares if they're 3D printing meat from something else? I mean, so that's how they're mixing salmon and all the other stuff. There's a lot out there.
That's crazy, isn't it?
Yeah, it is. We talked about this before about living systems and what they need to work properly, the parts, power, information, and what happens when that information goes wrong. Typically shows up as some sort of a symptom. There's a cause and effect to it, right? So one of the things that one of the researchers has said out of one of those books is talking about inflammation being a big component to depression. So we talk about that all the time. Most diseases are associated with inflammation. Most people are inflamed because we're imbalanced. We don't have a homeostasis when it comes to the things that keep us balanced. We're overdoing some stuff, not doing enough of others. So inflammatory conditions are a big part of it. Stress-induced depression, right? There was a study where they did with mice, and you can see behavioral depressive symptoms, and then microglia is that neurogenesis where you grow like new things, new brain patterns, and so that doesn't happen either. You see what I mean? Kind of slows you down a little bit. You're wondering what's wrong with these people? They're a little slow, but because they're not really progressing there. We talk about this health, where it comes from. You don't want to watch a video? I have a video.
Okay.
So it's not playing any sound, but it's talking about the brain and the spinal cord. And then showing you kind of where these go. So the spinal cord, how it's an extension of the brain. And there's all these different levels that cover it. And that's why when you are, that's why one, it's important to get adjusted. right? So when you're talking about dealing with the spine, that's movement at the deepest level. That's freeing up that communication between the brain and the body, making sure that there's clear pathways there for that communication to happen. So this is showing you all the nerves, how they run down through the spine, go out to every organ and tissue of the body. But in addition to, it's all covered by bone, right? So it's got to be important if it's covered by bone. Yeah. So it's protected. And so that was one of the big things there, talking about how these different nerve cells, how they repair themselves by having clear communication. So there's that. And then I wanted to show you, I think I showed you this before, you saw this before in another one, where it shows you all the different connections that happen to all the different parts of the body.
It's like on the bottom of your foot, the different parts was connected to other parts of your body.
Right, that's like with reflexology.
Yeah.
But it also happens in the ear.
Oh.
There's different parts in your ear that's connected to different parts of your body. So that's when I do the auricular therapy. That's what I'm doing. I'm stimulating different parts of your ear to correlate with different parts of your body. And so by doing that, people a lot of times allow themselves to balance out and heal from different pains that they may not have been aware of. Like there's certain ones that are like lower in your ear that help with like brain function. So a big part of that, we're getting off topic again.
Yeah.
But it's okay.
Yeah, it's okay.
But another one that like dealing with auricular therapy, that was a big part of treatment when it comes to compulsive disorders. So the American College of Addictionology, they use that with the other little instrument I use in conjunction with some other like nutraceuticals, like supplements, stuff like that to help balance out a person's brain and help break addiction patterns. So when I was in Tennessee, I would use it with people who were smoking. And I would just do that with them with the adjusting. And they would come back and say, well, I don't really have a lot of cravings.
A desire.
Yeah, for this stuff anymore. They didn't have it for tobacco. They didn't have it for like
drinking,
the smoking, the chew.
Oh.
I even had some of the hardcore drug people too, and it broke that pattern.
That's good.
And I was tell you this story. Nobody probably knows, and they're probably not listening. But this was years ago, so it doesn't matter anymore. But there's somebody who was when they were coming to see me, they were fine. Their partner was happy with them. When they stopped coming to see me, they ended up with a cocaine addiction. They already had the cocaine issue. When they came to see me, they stayed away from the cocaine.
Okay.
When they stopped seeing me, they went back to the cocaine.
Oh.
And that person came to me, broke down in tears, and was like, my other person made me come see you again because this is what happened when I stopped. But I never knew they had that problem. I was just adjusting them. I didn't know they had that problem.
But when something else,
right? Because a lot of times people have addictions to like drugs like that because they have some sort of pain, and it's like a deeper pain that they may not be aware of, but they know when they're on this drug that pain goes away. Which is a lot of things when people get hooked on opioids, right? They know there's an obvious pain that they have, but then they're so accustomed to living that life. Oh, I don't have pain when I do this, and then their body becomes addicted to that, and so. Part of like, you're getting adjusted on a consistent basis. Now you don't have this issue anymore. So I thought that was pretty cool.
It was, yeah.
When the other part when it comes to this stress and inflammation and that type of stuff, you can see it's a big pattern here. Childhood, some of the things that happen. Adolescence, elevated inflammation, you see that in there. And then in adulthood, you start going back and forth. This anxiety and depression. Because you have that mild inflammation in childhood, because some of the stuff will be eaten. So you have that issue there. And then you got perceptions of social threats. So that's the social media stuff, right? So that you have some of the other people who are around. You got this comparison syndrome. You have all these things happening around this age. And then you got anxiety associated with it. So later on that increases elevated inflammation. So that's one of those patterns we're looking at there. And then think about it is putting this all together, right? So that whole it takes a village, because it's multiple components. It's not just one thing. It's a lot of different things that happen at once that we kind of need to be in motion at the same time. So we're talking about time. So we're talking about emotional support from a lot of different people. We're dealing with our information. That's our nervous system, how that communicates So there's no point in putting all this good food in if your body doesn't know what to do with it. There's no point in taking all these great supplements if your body doesn't know what to do with it because it can't communicate. And then you start talking about making sure you're having the right things that you're putting in. So that's your power and your fuel. Making sure your body, your gut is healthy. You have all the microbiomes that you need. So you have great digestion. So again, extracting all the nutrients that you need from different foods. You're letting your body repair itself, right? We talked about before that detoxification system, making sure that's functioning. So we can get rid of the things that we need to. So that means we have a healthy liver. We have a healthy digestive system, healthy kidneys, all that type of stuff. And then movement and behavior. So actually being in motion, like I was saying before, like walking is enough to get you out of depressive mood. Anytime you're in a depressed mood, movement in itself is something to get you out of, right? It's just like if you were stuck someplace, if you start moving, then you at least feel like you're getting unstuck. Like even if you're stuck in the snow and you start rocking a little bit, that little bit of movement, you feel like I'm about to get unstuck.
Yeah.
It's the same thing that applies in life. If you're stuck someplace and there's a certain pattern of behavior, when you start moving, just rocking your way out of it, that is enough to start getting you unstuck, right? It gives you hope, it gives you some purpose, it gives you some drive, all those different things by going through some movement, right? So that is a big thing there.
I never heard of leaky brain. I heard of leaky gut. Leaky brain, is that?
So leaky brain is it's similar to leaky gut, but it's like things that cross the blood-brain barrier, right? So if you have like aluminum, if you have a lot of
Toxins or something?
yeah, like sugar, overabundance of sugar, like they say Alzheimer's, type 3 diabetes, well, because you have a lot of blood sugar in your brain, that type of stuff. So you have these different things that are causing your brain not to function as it should. So we have that type of stuff there.
I just want to ask, because I've heard it now, do they measure the brain? I heard some people say one side may be smaller or larger than the other. You can measure the brain, or if it has increased or gotten, I don't know.
Well, you can measure through, I think it's fMRI measures like different patterns that, like they get you excited. So which parts of your brain like light up. So you can do that with the fMRI. I think maybe CT. One of the MRIs, it's either MRI or specific CT that allows you to see the brain. You know, you can see the size of it, right?
Okay.
So you can look at something smaller, something bigger, that type of thing. Neuroplasticity, though, is the rewiring of things in your brain. So you can always learn new skills. And you can do simple stuff to learn new skills, like if you're right-handed, brush your teeth with your left hand.
Yeah.
If you're right-handed, eat with your left hand. You know, you start to develop other sides of your brain. People always talk about me about listening to all this different type of music that I listen to in the office. That's intentional. So if you want to listen to, if you're developing different parts of your brain, you want to expose it to different things at all times. So you want to have something that is far extremes in both directions, because it helps you find a balance.
Okay.
You know, so if like people who only eat pizza, right? You come over here and eat some salads and fruits and that type of stuff. And then you rotate that stuff through and keep exposing yourself to new stuff to give your body a chance to help you, right?
Yeah.
So you get exposed to something new, you be like, oh, I think I like that. And, you know, because you felt good or you felt, you know, energized by it, then that's something else. You know, so you have to kind of keep exposing yourself to a variety of different things to keep your brain balanced, and you start growing new stuff. Listen to all kinds of stuff. Listen to the things that you oppose. If you're a Democrat, listen to the Republican stuff. If you watch Fox, watch MSNBC. I mean, you need to hear both sides of the story. Even if you wanted to argue it, which I don't think is necessary. Because it's two sides of the same coin. But I'm just saying, learn what a different perspective, right? So a different perspective is great.
That's good.
Thoughts, feelings, emotions, and the spine. A lot of this is talking about how the spine stimulates the cerebellum, which is what comes from movement. And that's why I was saying that the spine is the deepest form of movement, right? So if you're getting that going there, then you're in pretty good shape when it comes to that one. Another research paper. This was about a lot of people didn't know this, but like early on in chiropractic, they had a lot of stuff where they actually worked with in sanitariums, like people who were mentally ill, and they were finding like a lot of people who had issues, who were in these sanitariums, chiropractors were actually helping them heal. So that went to lend it to the chiropractic. Didn't start out as neck pain, back pain. It was like the other side of what is now medicine. But they tried to bury chiropractic because a lot of stuff that was happening in terms of natural healing. Well, if you get rid of the natural healers, then now you make room for the drugs. But if you got these natural healers here, our drugs can't persist. So now we have a problem. So we got to get rid of them. And then somehow chiropractic got pigeonholed into neck pain and back pain, when they were doing far more than that for most people. So they had like 4 or 5 sanitariums where they would actually go in and work on people and got great results with helping people who have mental issues.
We need some of that now.
Now I'm here, I can only do so much though.
Yeah, that's one of you, right?
Another result for specific, there's a friend of mine I know who had to deal with depression. There's a specific type of upper cervical technique that actually helps, that has been shown to help people with depressive issues. So a lot of chiropractic stuff, depressive issues, hypertension, and the ringing of the ears can actually help. A lot of people think, oh, these things are not things that you can really cure. But yeah, they are. A lot of the benefits, side effects, are really health effects, side benefits, I guess, that we're talking about when it comes to chiropractic. So reducing stress is a big one. Increasing reaction time. Not increasing, but reducing. So if you're an athlete, somebody who's trying to go at the firing of a gun, you go just that much quicker. If you're somebody who's playing basketball, your jump shot is that much quicker. All these different things. So you have that muscle strength, overall athletic abilities, a ton of different benefits when it comes to the chiropractic part. This was, can you see that? So see up there at the very top, that was published last year
2023
in April. And it talks about how this gut microbiome and anxiety and depression, how that relationship management options, right? So it's basically saying that the gut microbiome and the brain, they're connected. And how when one is off, the other one is off. And it shows that there's significant evidence that links anxiety and depression disorders to the community of the microbiome that lives in your GI system, so in your digestive system. So if that's off, then this is off. It's pretty much an easy, simple situation. Fixing it is modifying the diet. They talk about fish oil in here because they talk about that omega-3s, because most of our diet is full of omega-6, which is inflammation, right? So now you balance it out with that. You start taking in a lot of different nutrients, macro and micronutrients, because again, those people who have those issues usually have the same food that you're eating all the time. And then you also have a couple other things that have done. There's the prebiotics, probiotics. There have been studies about people who have, they've taken the feces of some healthy people and transplanted it into the microbiome of other people, and it actually helped them in situations. It was like people who were skinny versus people who were overweight. And they took the skinny people's microbiome and put it into the overweight people's microbiome, and they started to lose weight. It's very interesting of how that happens. But it goes back to the microbiome and how it looks and what bacteria is there for people to work with. And then we always finish up with what else can we do. It's learning more about what we have going on so we know what we can actually do. That website's the same, Test with Dr. J. Ware. There's a micronutrient test, the gut health test, vitamin D, food sensitivity. There's the A1C test, we talk about the blood sugar and how that impacts us. Hormone test, weight management test. The gut health test is probably the best when it comes to this stuff. And getting what bacteria is in there, what do we need to add, and what do we need to look at changing. And so that one in particular, I like, because it allows, you can do a lot of different things with it. And then you can restructuring your gut biome. It's not a difficult thing to do. You just have to be open to different foods. Yeah. Right? So it doesn't have to be a supplement or drug thing. It could be a food thing. As long as you're open to different foods, which most people don't want to take the time to deal with different foods because they're, for whatever reason, they're always feeling like they're in a rush. But planning those different types of things are beneficial overall, all the way around. So you're actually in good shape by doing it that way. Okay, are there any questions? I know.
So basically you're saying people, if their gut's clean, their mind is gonna clean up too.
Exactly.
Starts with here, where all that
Yep.
mental illness, depression, whatever they gonna call it, anxiety.
Yeah.
It's here. This is off. You're gonna be off up here.
Yeah, because
But no one tells you that because I guess they have another agenda. But that's good, Dr. Ware, that you have all this knowledge, and it's just so many people don't know. You know?
Yeah, I mean, it's relatively simple.
Yeah,
Like,
but no one tells you.
I had
No.
Or
one
they don't
doctor-
think like that.
I had one doctor some years ago. I was going to IU, and you know they spend 10 or 15 minutes, and on his way out the door, he said, "Keep the weight off your stomach. You stay out the doctor's office." But he didn't tell me
how to do it.
how to do it. He just said, "Keep the weight off your stomach,"
Yeah.
You just gave
and,
you
and that was it. And I've heard over the years, even today, I listen to Dr. Becker on television. 70, and but he had a guest on there. 70% they said of your health is in your gut.
That's like 70% of your immune system.
Yeah, in your immune system.
Yeah.
And that's what I'm working on to get, you know.
Yeah, well, if you don't have the right things in your immune system, then yeah. So this is like when COVID happened, a lot of people who were overweight got hit the hardest.
Mm-hmm.
Well, if you're overweight, more than likely you don't have the right bacteria in your stomach to begin with.
Mm-hmm.
So you're not eliminating toxins, one. So you have an accumulation of toxins, plus this other thing that came about. So now it's all this stuff interacting. Now it comes up with these big, different issues.
Yeah.
Long haul COVID, all that type of stuff. Usually you find that in people who are bigger, right? They have those long-term symptoms, can't breathe right, all this different stuff.
all that stuff.
Yeah, it's because it was already there. They just exacerbated it. It made it all worse.
Right.
Right.
Exactly.
So that's the type of stuff you're dealing with when it comes to that. So that's stuff to keep in mind. But if 70% of your immune system's here and you keep this clean, that means you can keep this clean. But there's so many ways for you to not keep this clean.
Mm-hmm.
It's so convenient for you to not do it because you got all these drive-throughs. You have all these like huge meals that people can have. You can supersize or
Everything.
Biggie or whatever cup, whatever, drinking stuff.
Some back seconds and thirds.
You have all these chemicals in the food. A lot of food. You have a lot of chemicals in the drinks that we have. You have television shows that keep you up all night so you're not sleeping. So you don't allow your body to detox as it needs to be. You have, you see it on you have a lot of chemicals in the air.
Yeah.
It's a lot.
Yeah, it's
There's
correct.
some things that we're missing, some fundamental things. A lot of people don't have plants in their home.
I know, they need them.
Make sure you get the
Breathe.
clean the air.
Yeah, there's a lot of different plants that you can utilize to clean the air in your home.
You think about when we were younger, the TV went off, what is it, midnight? No
Sometimes.
TV.
Yeah.
Yeah. That was a good reason why they did that.
Yeah.
So you go to sleep, so you can rest, so you can be.
Right.
So I think about too, my parents and them, they didn't have vaccinations when they were younger. Back in the days that, that was.
Well, it's just so many now.
I know it's ridiculous. I was just telling my daughter, I was like, why do you just, I can't.
Is she trying to get the baby vaccinated or something?
Well, she goes through those things, and I said, you went through the natural birth and all that stuff, stood there, dropped your baby, and now, because I didn't have my baby in the hospital, and now you're doing, the doctor said the measles are going around. I said, the measles, they always use something to scare tactic you to think.
It's all okay.
So it doesn't mean you'll get measles.
Fear moves people.
Exactly, and I told her, I said, you are just totally not what I'm saying.
And the thing about like measles is, nobody's like dying from the measles.
I know, or polio, or that stuff that they. And as I said, you kind of like you go through a trend and you go through it, and it's okay. I had chickenpox.
Yeah.
I mean,
so
and it's gone my face. I mean, but you have to go through it for your immune system to build up.
Mm-hmm.
Yeah.
That's my thought process. But
that's a good thought process.
I was trying to convince my daughter, thinking, you're just kind of, why did you do all this for this?
Yeah.
To
that
poison
doesn't make
him.
sense.
That's what I told her. I said, you're not, well, and I said, if he gets a cold, it's because he's supposed to get a cold. Because
That's how the
it's
immune
building up.
system builds.
Yes.
Alright.
Okay, so you said the first one you should take is the gut health test. Is that what you're saying?
I like that one. We still have to finish.
Yes.
But yeah, I like that one. It's a
Why
good-
you say the vitamin D? Because we don't get sun.
Vitamin D, because a lot of people, your immune system is built by vitamin D. I work with a lot of athletes, so a lot of athletes have stress fractures due to vitamin D deficiency.
Oh, okay.
And then most people who are of a darker hue, such as myself, it's hard for us to get enough vitamin D in this amount of sunlight. So they have to be out there for a long time.
Unless you're in Florida, huh?
Well, I don't even know if Florida could do it. I mean, it may be able to do it, but especially up in the Midwest, it's difficult. You don't get enough.
Yeah.
And so supplementing with vitamin D is good.
Pretty
That's
much
why-
we don't try to get in the sun no way.
Right, and for some reason we have this weird thing, and we say, "Oh no, I won't get in the sun." But
Could get darker.
that's But a lot of the reasons a lot of cancers are worse with us is because we don't have enough vitamin D in our system.
Vitamin D and magnesium.
So it's it's like one of those weird things. Like, how does this myth perpetuate throughout our culture? Stay out of the sun, and that's the stuff. That same thing that's killing us. Interesting. Because you get vitamin D from the sun.
I know.
But if you gotta stay, if your people have been telling you to stay out of the sun
Because
forever,
they always,
you just pass down these levels of, I guess it's kind of ignorance in a sense. And then you sitting there, unbeknownst to you, you just knocking yourself out, All right. Once again, thank you. Thank you very much.
Thank you.